The CADRE project, CADRE stands for Collective Action Democratized by Relevant Experience. It's a project to bring a cadre, a group of leaders with lived experience who are interested in influencing policies and making changes, innovative approaches to mental health issues in this country. It's a nationwide educational program and it has 3 parts.
HBCUs, historically Black colleges and universities, are overlooked when it comes to the policy space and really raising up the visibility of what type of change can be realized when plugging into networks that Dr. Hairston and the medical community can help bring forth.
This project is actually the brainchild of Karis Myrick, who is active on Capitol Hill, active in changing policies, and really wanted to see the way that mental health is practiced change. Through this course, you will learn how to have a broader lens, a really systemic lens to how things like rent control, a race of renters, redlining, predatory mortgage lending practices impact mental health and how we can change these policies. The lessons are unique because they are really looking at co-designed innovations. They're looking at approaches from people from a multifaceted group. They might be leaders in policy, they might be leaders in the government at a state or federal level, they might be teachers, they might be educators.
This is so unique because you have a clinical psychiatrist who's actually partnering with policy in a way that brings her practice and the residency program into the firsthand lived experience with lawmakers.
I always used to say, if only I could get behind that door or in the room at that table where I could truly affect policy change with my lived experience. Dr. Hairston and Karis Myrick, they have given me the hope that they're in the rooms and that it is possible.
So having the opportunity to participate in the CADRE program and receive more in-depth training and awareness around policy, specifically pertaining to mental health, and with minoritized populations has been very insightful.
Through this experience, I learned the importance of showing up and making a group. Today at the Senate, I really liked how everyone was active and asking questions. And I feel like for me, the younger generation, we need to see and experience things like this in mental health.
There was a mobile app that you would be able to use to complete the education portion, which consisted of videos and speakers. And one thing that I loved about that is it makes it accessible to multiple people.
And I love the app. I thought that was very innovative. It's very modern. I think it was very easy to access, very easy to understand.
I learned so much from the videos. They were really helpful. It really gave me a lot of preparation before coming to the conference.
The videos were really good. I enjoyed hearing people's lived experiences. I feel like it was very engaging, words about how mental health and hip-hop are connected and things like that. So I really enjoyed it, and I think it should be shared to other organizations.
I can go back, I can always pull up a resource. I'm able to take that resource and share it with others.
One of the key components of CADRE is building this community and having a support network.
I really appreciated the opportunity to meet in person with such a diverse group of individuals.
My voice really does matter.
The intersectionality between public policy and communications is key for this group. Taking your experience and your stories and positioning that in a way that creates narrative for policy change.
I would like to strengthen the peer workforce. I know the impact that peers have. A national peer certification, develop pathways so peers can sustain and thrive in their peer role.
The CADRE project is doing wonderful work to bring more people into the fold.
But in 2 years' time, I would love to see programs like CADRE implemented, the curriculum to be included in medical education across the country.
If I can have a magic wand and this program is in Jersey City, I will allow and open that door for so many other people to have that opportunity, to have their voice heard.
I hope that CADRE teaches people to think outside the box.
I'm going to ride on that hope and learn the impact of policy change so I too can advocate for policy change.